Hi, and welcome to St. Lucie Medical Center. You're here today for the Preoperative Orthopedic class. And I just wanted to introduce myself. My name is Tara Baer, and I'm the Orthopedic Navigator here at the Orthopedic and Spine Institute. A little background about myself. I've been a nurse here for 9 years. I hold my bachelor's degree from Indian River State College for nursing. I as well have a psychology degree from Florida State University. A little known fact about myself, I was born in Fort Pierce, Florida as well. So I just wanted to say welcome, and everything that I'm speaking about today is in this orthopedic patient guide book for y'all. It is very useful and resourceful. So welcome. So what are our objectives today? We're going to meet the educational needs of the orthopedic patients before, during, and after their hospital experience. To address patients' questions or concerns prior to the surgery and provide preventable complications after surgery. So what do we do to prepare for surgery? We're going to focus on our diet. You want to make healthy choices. You don't want any fad diets, no restrictive diets. So that means a diet full of iron, protein, calcium. You want to make sure your body is in fighting shape for surgery. You're here to get better, so let's get ready before coming in for your marathon. A dietitian is available to you during your hospital stay, so if you ever have any questions about that, let us know and we will get someone to come talk to you. So also, you're going to be in pre-admit getting a nasal swab. It's going to be in your nose to test for MRSA or MSSA. So with that, with your results, if you are positive, you will get, it's called mupirocin. It's an antibiotic to help prevent infection. And you're going to put that in your nose. But some doctors' protocols, they actually do offer it 5 to 7 days prior out, but you get that at the doctor's office. It just depends on the doctor's protocol. So our pre-surgical antiseptic shower. So this is what it looks like. You're going to get 2 bottles given to you here. And what it is, it's chlorhexidine, which destroys bacteria. So that's like your pre-body wash. You want to get your body really clean for surgery. So you're going to go from your neck down. Okay, you're going to avoid your eyes, your ears, because it could irritate those areas. So what you're going to do is lather up really, well for about 2 minutes, focusing on your knee, hip, your back, your shoulder, whichever you're having surgery on. You want to, all over and then focus on that surgical area. And then as well, according to doctor's protocols, you will be given it directions either 5 to 7 days out or night prior to surgery to complete, and then in the morning before you come in to do another pre-surgical shower. So after you do those, during the morning of your surgery, you don't want to put any lotion, creams, deodorants, or powders to that area after the use. Day of surgery, they really want your body really clean, help prevent infection. So what do you want to bring to the hospital? So this is your small personal items like toothbrush or soap. You are provided with a little grab bag here, but some people are very particular, like if they have dentures or if they have special needs or special toothpaste. 2 comfortable outfits. So for our ladies, we want a flowing dress or some comfortable pants and shirt. For gentlemen, we'd say a t-shirt and gym shorts. Anything that will help you recover, make you feel better about yourself when you're walking. But if you do have drains, you probably may have to use the surgical gowns or the hospital gown that you'll have. That will be provided to you. If you want to bring your sneakers, those are closed-toed shoes. So no flip-flops, no sandals. We don't want you to trip and fall. You've waited so long for the surgery, so we want you coming in and being safe. If you have an orthotic shoe or any type of special shoe that assists you with your walking, you should bring that in so you could use it with physical therapy. You can use your cell phone or your electrical devices like a laptop or iPad, Kindle. We have guest access here. But we don't want you to wear jewelry. We want you to keep those valuables at home. We want you to keep those, most valuable sentimentals. We don't want them to get lost here. So just a little note to keep that at home. So now we're going into preparation for surgery, your medications to avoid 5 to 7 days prior to surgery. So this is your ibuprofen, aspirin, Indocin, naproxen, and an anticoagulant, which is warfarin, or you'll have special instructions for Xarelto. We just want to make sure your blood is not, too thin, because those are blood thinners. Your doctor also gives you a very long list of medications, and it is in the patient guide as well. And if you do have any questions, always reach out to your surgeon, or you'll be talking to a nurse here at the facility as well, getting your history. So this is what's changed. In the past, when you've had surgery, you've been nothing by mouth after midnight. Well, evidence-based practice, we want to make sure you have best practices here and safest. You are allowed to have clear liquids, which consists of water, black coffee, so no creamer or sugar. You can have those all the way up until 2 hours prior to your arrival. So what's important about that is at least your body's getting hydrated still. Another thing that is different that you're probably not used to, this is the Ensure pre-surgical drink. So what's in here is electrolytes, things to help your body balance out. Like we said, you're going through a marathon. So what do marathon runners drink before a race? And this is not just a regular Ensure. This is a pre-surgical clear liquid drink. So you're going to be given 2 bottles. So you're going to have one at nighttime. So we usually instruct like 9 p.m. Then the second bottle is 2 hours prior to your arrival here. They want you to be completed with all that and nothing by mouth at that time. So what else do we want to encourage before surgery? Light meals the day before your surgery. So that's salads, sandwiches, nothing too heavy on the stomach because of the anesthesia. Day of surgery, what are the medications they want you to take prior to surgery? Cardiac medications. So for instance, beta blockers or things that help with the heart rate. They don't want you to stop that before surgery. Your Synthroid, it is okay to take that. But if you are a diabetic, you can't do your insulin or things like that because we don't want your blood sugar to really, really drop before surgery. And you want to take that with sips of water. So what is important, day before surgery, after 3 p.m., a surgical representative will call you with what number is provided. So say you have surgery on a Friday. They will call you on a Thursday from around 3 p.m. to about 6. Give them some time because they are making sure where you are listed on the surgical schedule and they want to tell you the correct time and not too early, but just the correct time to come in. If you have surgery on a Monday, you're going to be called on a Friday. So you'll be called on that Friday between those hours of 3 and 6. Of course, if you have any questions or you don't hear from us, please call the hospital and we will give you any information we can. So your day of surgery, where do you want to enter through the hospital? So you're going to go through the outpatient area, which is in the ER, by the ER. And someone is going to escort you to the holding area from there. The day of surgery, it can vary, so let's see what we can do about, visitors and whatnot. So, holding area, this is where the anesthesiologist will discuss pain management with you, and they will go over any certain questions one-on-one with you. If you have any concerns about anything, this is time to ask them, and so before even getting any anesthesia or anything to put you to sleep. And if you're getting a total knee replacement, you will have a nerve block. So what's that going to do? That's going to make your leg feel really good. It's going to make you help with that pain management. It's going to help you with your recovery. So if it doesn't work for some reason, let us know so we could try to keep you comfortable. So your IV is going to be started. Please let us know if you're a tough stick too, just so we want to make sure you're safe and you're comfortable. Oxygen may be placed if needed. So you are going to assist in marking the operative site to make sure correct leg, correct hip, right side of the body, the back, or the neck. You are going to be given that chance to help assist the physician in where you're going to have surgery. And that's all for your safety. Antibiotics, they're going to be started through your IV line. So please make sure you tell us any allergies so we could find alternatives for anything. The surgeon, operating nurse, and holding nurse, they're going to be available for any last-minute questions, concerns, or requests. So please let us know. So now we're to the operating room, the phase that, you've been waiting such a long time for surgery. So it's going to be performed by your surgeon. He'll go over specifics with you in your individual case prior to surgery. Please, in the holding area, please leave the cell phone number of the caretaker, family member, or whoever you'd like the surgeon to call after surgery. Make sure that's with them. And then the surgeon will contact your family or designated person when the procedure is complete. So now we're on to the recovery room. You're going to have IV, you're going to have oxygen in place if needed, you're going to have a recovery room nurse, and anesthesia will be available at your bedside. So the nurse is going to monitor that extremity you had surgery on. So they may ask you, can you wiggle your toes? Can you feel this? They're going to be checking the warmness of it. And that is all with circulation to make sure blood is flowing all throughout the body. Once you're stabled, you will be transferred to the orthopedic and spine unit. If you need a higher level of care, like say ICU or a cardiac unit, of course, you'll be sent to where you're safest. So you'll be in recovery for at least 2 hours. So say you have a total knee or hip, like an estimation of timeline is about 1 to 2 hours in holding, 1 to 2 hours in surgery, and 1 to 2 in recovery. So that's about a total of 6 hours, for a total knee or hip. But it could vary as well according to your surgery. So I just wanted to let you know. So up on the orthopedic and spine unit, you have a healthcare team members caring for you during your stay. You have a long list. You have your primary nurse, who's your nurse at bedside, your nursing assistant tech, who assists the nurse, the physical therapist, your physical therapist, who will be going over your exercises with you, an occupational therapist, who helps and assists you with your activities of daily living. And of course, they're going to be going according to any precautions that the surgeon has given for you. A respiratory therapist. We want to make sure you're breathing and you're doing really well getting oxygen. Dietitian if needed. The floor does have a charge nurse or a patient care coordinator. The orthopedic navigator, and that's me, Tara Bear. Your orthopedic and spine unit director is Tammy Speed, and I can't wait for y'all to meet her. Your surgeon or somebody from your surgical group will come to see you daily. Make sure you're safe and you're stable, pain is managed. And then if needed, there will be a medical doctor consultant. So if your doctor does not come to the hospital, they will assign a hospitalist for you. So you will be monitored very closely that first day of surgery. They're going to be taking vitals quite often for you, making sure your blood pressure is okay, your pain is monitored, and medications can be administered. Your assessment's overall and pertinent to your type of surgery. We want to make sure you're safe. Things you're going to be attached to or have. So you're going to be basically bionic. There's going to be quite a few things attached. You've got your IV, possibly oxygen, and you may be attached to some drains. So first, you have your hemovac or you have your constavac. So what these devices do, they help prevent swelling to your incision. The difference between them is the constavac, which is this one. You have enough drainage, it could be what's called a reinfusion with your blood. So a mini blood transfusion, to say. And that helps to make sure that your blood levels keep stable. Or you may come out with no drain, which is what the doctors want. When they get in there is when they feel the need if you need the drain or not. And your incision, your dressing will be dressed according to your surgeon's protocols. So whatever it will be, it helps prevent infection, and we get orders for when to change the dressing and monitor for drainage or swelling or redness. We are monitoring that as well and in communication with the doctors constantly for you. So side effects of your medications. During your hospital stay, some of these side effects may occur with medications you receive. Main ones are nausea and vomiting, dry mouth. We've got plenty of ginger ale on the floor for you. Itching. Sometimes those pain medications, narcotics, can make you itchy. So let us know. We can do either lotion for you or if you need some Benadryl. We just want to keep you comfortable. Constipation. This is a big one. So stool softeners and laxatives, they will be ordered for you, to help with those needs. But we also have prune juice on the floor. So that doesn't need a prescription, so we have that as well if you like. And what we do, a little special trick with it, we warm it, and something in that warm prune juice helps activate. So that's what we have for you. And then what are the 3 P's that you need to have to be able to go home or to rehab? Well, you have to pee, you have to poop, and your pain has to be managed. So the 3 P's, then you know you're ready. But let us know if you're experiencing any of these symptoms, and we will have something available for you. So here's a big one, goal-directed pain management. For you to recover, your pain has to be managed. So you can get up with therapy, you can get moving. So you will be before surgery and on the floors. This is a pain card that you're going to have. And it asks you, or you will be asked numerous times, what your acceptable pain level is. So this is a very important card, and the nurses are in constant communication with you to make sure you're comfortable and what level you can do your therapy with. And what pain management does, it has successful outcomes, positive outcomes for you as the patient. And that's what we want. We want you to get moving. So we're going to ask you quite often, what on a scale of 0 to 10, what's your level of pain? So we do want to keep that current, so we'll have the current pain level and what's acceptable. So how are we going to manage your pain? We have pain management pathways. Nowadays, what our surgeons have is the multimodal pain approach. So what this is not going straight for the narcotics. They are having either a non-opioid medication given on a specific schedule, which is Tylenol, which is a pain reducer, Toradol or Celebrex, it's to help reduce pain and inflammation for you. It can be given either by mouth or IV. Gabapentin or pregabalin, it blocks nerve pain, and that's given every 8 hours. Cold therapy, and so it's a non-narcotic and it's not medicine at all. It helps to prevent swelling and can help with pain management. So your prevention of complications. So there's several items put into place to help prevent any acquiring complications. So your SCDs, or sequential compression device. So this is a pump that actually goes around your calves, okay? And it prevents deep vein thromboses, or PEs. And what it does, they're on both of your legs. They are alternating the pressure, helping bring that blood flow back to the heart and helping prevent any clots. I call them the massagers. So they're really, I feel that I've heard from patients that they're very comfortable. So TED hose, these are your compression stockings. They are white stockings. You are going to be wearing these during the day and then removed at night. They help prevent blood clots as well. Your anticoagulation therapy to prevent blood clots, your Coumadin, your Lovenox, Xarelto or aspirin. The doctor, their protocols, they will put you on something. And if you do have a back surgery, you will not be put on that because they want to prevent any bleeding from the back surgery. Incentive spirometer. So this is a big one. This helps prevent pneumonia. So your doctor actually orders this for you to do 10 times an hour, every hour while you're awake. So how do you remember doing it? Well, we say when you're sitting in the chair, you're watching TV, that helps, remind you. So whenever you see a commercial, do your incentive spirometer. It just helps deep breathe, make sure no fluid collects in the lungs, and helps prevent pneumonia. And you can do this as well when you're at home. And it doesn't have any medication, it's just helping you deep breathe. So up on the orthopedic and spine unit, you want to call, don't fall. That's our motto. So do not get out of bed yourself. Staff is going to be available to assist you at all times. You will be assisted in washing daily or bathing, but we do encourage you to do as much as you can independently. So if we sit you in the chair or in the bathroom by the mirror, by you doing, helping wash yourself, that helps with deep breathing and can help with recovery. Of course, if you need help, do let us know so we can assist you with that. So here's a big one. So now you've had your surgery, physical therapy. So majority of the surgeries, they're going to see you the first day. If you're a total knee or hip, you're going to be seen twice a day, in the morning and the afternoon, but it all depends on those doctor orders. And also, early mobilization helps prevent complications. A physical therapist will make sure you're stable. Say your blood pressure is good, you're not dizzy or lightheaded, and to make sure your pain is okay. They're going to evaluate you and assist you with the decision of going home or if you need inpatient rehab. They will also go over any precautions you may have after surgery, depending on what you have, like a back. You're going to do no bending, lifting, or twisting, or your hips. You don't want to cross your legs. You don't want to, squat or sit in low chairs. But your total knee, I have to say, you are full weight bearing, so you'll be able to, unless the doctor says, you'll be able to put full weight on your leg. As a total knee patient, depending on the surgeon's protocol, you may have a machine, what's called the continuous passive motion machine. If not, your doctor has not ordered it, it's because their protocol does not see that you need it. Discharge planning. Your personalized plan is either going to be home health care, your nurse and therapist will come to your house 2 to 3 times a week, or inpatient rehab, which is a 24/7 care, skilled nursing facility, or an inpatient rehab. Your third option is outpatient therapy. So this is when you're going to be able to start driving to physical therapy and either at your doctor's office or your choice for therapy services. Transportation. So day of discharge, your family or your friend, they're going to have to help you. We are going to help you into the car or vehicle, but they're going to have to be able to help you out. If you go to a rehab, we'll help you into the wheelchair or the stretcher, but they're going to help you out. So we'll go by the precautions and we'll make sure you're safe. So day of discharge, you're going to have a physician order is needed prior to discharge. Surgeon and medical consultant must clear you for discharge. And the physician's going to complete your medication reconciliation. So what is that? That is exactly what the doctor wants you to have upon discharge and continue. Either home medicines or any new medicines added, it is what they want you to take. Any prescriptions that you need, you'll be given those, or sometimes with surgeons' protocols, they are giving it in the office prior to even coming in for surgery. Just depends on your surgeon. So we say the total time for discharge takes up to 4 to 6 hours. Well, we actually aim for early afternoon. So why do we say that? We want you to get your last round of physical therapy before going home. Make sure you have your bowel movement. Make sure the nurse is able to go over any instructions with you. And just make sure you are, aware of what's going to happen when you do go home. So if you go home with home health care, your nurse is going to provide you with written discharge instructions. Equipment or delivery, your home health care will be set up by our case manager or your insurance provider. Rehab or inpatient facility, your orders are going to be directly sent to that particular facility and any prescriptions as needed. They're going to provide you with either any equipment that you need at the rehab, so you don't have to worry about that if you do go to a rehab. Equipment if going home. So your walker will be delivered to the hospital. Your continuous passive motion machine, you'll call the company when you do arrive home. So when you're at home, within 48 hours of discharge from the hospital, somebody will call you for a discharge follow-up call. It will be either myself or somebody from our team. So you want to call your physician, though, if you have any of the following symptoms are present. A fever of 101 degrees or higher, increased drainage from your incision site, pain not relieved with any medications, swelling of the legs not relieved with elevation or ice, because that could mean a blood clot. So it's very important to call your doctor. And of course, call 911 or return to the ER for any chest pain or shortness of breath. Any signs of stroke, one-sided weakness, slurred speech, you do want to call 911. That is a medical emergency. To pre-register for your appointment, if we have either an email or a phone number on file for you from your prior visit, you will receive a reminder email and or text that provides the steps to take in order to complete your pre-registration. If we do not have your email address or cell phone number on file, you will receive a call from the pre-registration department to complete the pre-registration over the phone. They can be reached at 877-351-7006, Monday through Friday, 8 a.m. through 5 p.m. That's the end of our presentation. You can give us a call back at 772-335-4000, and my direct extension is 3614.